Every 5 minutes in the world, there is a person who is diagnosed with multiple sclerosis, and this adds to the almost 3 million people who already live with this disease. Multiple sclerosis is the most common inflammatory demyelinating disease of the central nervous system and is among the leading causes of disability in young people, with an onset generally occurring between 20 and 40 years of age. Multiple sclerosis is considered an autoimmune disease as it is due to an abnormal reaction of the immune defenses that attack some components of the central nervous system, damaging both myelin and the cells specialized in its production, that is, oligodendrocytes, as well as nerve fibers themselves. We recall that myelin is a lipoprotein substance made up of 70–80% lipids and 20–30% proteins and covers the axons of neurons like a sort of sheath, that is, those extensions of nerve cells that have the task of conducting the electrical impulses. Multiple sclerosis can affect any area of the central nervous system, particularly the spinal cord, cerebellum, and optic nerves, clinically resulting in a wide variety of neurological signs and symptoms, the severity of which depends on the extent of the damage. Progressive demyelination, that is, the loss of the myelin sheath, slows down or stops the conduction of electrical impulses, and therefore the communication between the brain and spinal cord, thus causing a neurological dysfunction. Let's go now to see what are the most common signs and symptoms of multiple sclerosis in the early stages. Visual disturbances. Optic neuritis is one of the most frequent clinical manifestations of multiple sclerosis. It is an inflammation of the optic nerve, a bundle of nerve fibers which has the task of transferring visual information from the retina to the brain, where it will then be processed and translated into images. Optic neuritis generally manifests itself with a reduction in visual acuity in only one eye. That is, it tends to worsen the eye's ability to clearly identify and perceive the details of an object at a certain distance. It is also often preceded or associated with periocular and retrocular pain that occurs with eye movements. In addition to optic neuritis, other vision disorders due to multiple sclerosis include oscillopsia, which is a sensation that the surrounding environment moves with the movement of the head due to a failure to adjust the position of the eyes. Objects seem to jump, jiggle, or vibrate. Oscillopsia due to multiple sclerosis is related to the presence of nystagmus and diplopia. The first indicates a rapid, rhythmic, and involuntary movement of the eyeballs, often caused by ocular or neurological injuries. The second one, that is diplopia, literally means double vision, as by observing an object it is seen doubled. This is because the projection of that object's image onto the retina of one eye does not exactly match the other projection onto the retina of the other eye. Alterations of sensitivity. Sensitivity disturbances are among the first symptoms of multiple sclerosis and occur in 1 in 2 people. They include a large variety of symptoms, even very different from each other, including paresthesias, dysesthesias, and decreased or loss of sensitivity to touch, heat, cold, or pain. In multiple sclerosis, the term paresthesia indicates an altered perception of the sensitivity of the limbs or other parts of the body to various sensory stimuli. Despite the absence of an external stimulus, tingling, tickling, itching, burning, or pinpricks may be felt. Dysesthesia, also known as tactile hallucination, indicates a disturbance in the perception of sensory stimuli that are perceived in an anomalous way, a sort of amplification of the sensitivity of the affected area, even if it is touched lightly. Paresthesias are generally due to lesions affecting the central or peripheral nervous system, while dysesthesias are due to a total or partial interruption of the sensory nerves, or from lesions of their roots or of the sensory pathways of the spinal cord or thalamus. Fatigue and weakness. A feeling of extreme tiredness can appear in the early stages of multiple sclerosis and occurs in about 80% of patients. It manifests itself with a lack of physical and mental energy, and it occurs even in the absence of effort or physical activity and does not improve with rest. It therefore becomes more difficult to perform many tasks, even the simplest ones, such as cooking, going to the supermarket, or using the computer. In relation to multiple sclerosis, fatigue can be classified into two types: primary and secondary. Primary fatigue is that due to disease, particularly the result of damage to the central nervous system caused by inflammation. However, the causes of this so characteristic symptom of multiple sclerosis are not yet known exactly. However, some hypotheses about its origin have been advanced, including a slowing of nerve conduction in the brain due to demyelination, increased energy consumption in motor activities, a metabolic deficit in some areas of the central nervous system, an immune system dysfunction involving inflammatory cytokines, and finally a disconnection between brain areas or an increased activation of the same. Secondary fatigue, on the other hand, is the one linked more to the emotional state, to the individual reaction to the unpredictability of the disease, and to a concomitant state of depression. It may also be due to the presence of other diseases or conditions, not necessarily directly related to multiple sclerosis, but which could be responsible for the onset of fatigue. Some of these are infections, sleep disorders, cardiovascular or respiratory diseases, balance disorders, and muscle spasms. Balance disorders are among the most disabling symptoms of multiple sclerosis and greatly increase the risk of falling, especially while walking or when having to go up or down stairs. Loss of balance is often associated with dizziness, tremors, and weakness of the lower limbs. In 75% of cases of multiple sclerosis, ataxia also occurs, a serious movement disorder due to a progressive loss of muscle coordination, which makes it increasingly difficult to perform voluntary movements. Muscle spasms are also one of the most common symptoms affecting over 3/4 of people with multiple sclerosis. These are involuntary and sudden contractions that can affect one or more muscles, voluntary or involuntary, and are very often associated with a stiffening and a feeling of weakness in the muscles concerned. In multiple sclerosis, the lower limbs are most affected by this disorder, thus making movements and maintaining posture and balance more difficult. This muscle spasticity is the direct result of impaired signal conduction between the nervous system and muscles, which in turn is caused by the loss of myelin that coats nerve fibers. Cognitive and language disorders. In addition to movement disorders and visual disturbances, cognitive impairments also often occur in multiple sclerosis, such as memory alterations, reasoning, learning, and attention. They are also called invisible symptoms because they are often difficult to recognize and understand. Cognitive dysfunction can already occur in the early stages of the disease, negatively affecting the speed of information processing. Executive functions, that is, those mental processes responsible for controlling and planning behavior. Visuospatial memory and episodic memory, that is, that ability to recall specific facts or events from the past. You may forget an appointment, have more difficult to concentrate, to plan activities, to do multiple things at the same time, or to stay focused for long periods of time. Some level of cognitive impairment occurs in 60% of people with multiple sclerosis, but only in 10% of cases is it severe enough to compromise the individual's independence. Among the disorders of the articulation of language instead, we find dysarthria, a condition characterized by the difficulty of articulating words in a normal way, which we remember, however, is very rare in the initial stages of the disease and is generally of modest intensity. It occurs due to a weakness or reduction of control and coordination by the central nervous system of those muscles that we use when we speak. It is therefore a motor-type language disorder due to neuromuscular impairment and can also be associated with dysphonia, that is an alteration of the voice, both from the point of view of its quality and its intensity. As the Italian National Institute of Health recalls, in most cases, multiple sclerosis initially manifests itself with episodic and transient symptoms, differing in severity, frequency, and duration, based on the areas of the central nervous system involved.